Hi there. If you've clicked into this presentation, I'd like to thank you for your interest. I'd like to ask you to join me in thanking the Donor Research Network as well for everything they've done to pull together this amazing symposium for us this year. I know I'm honored by the opportunity to share our findings with you as part of the symposium. My name's Shana Hughes. I'm an applied medical anthropologist and assistant investigator at Vitalant Research Institute in the United States of America. Today, I'm going to be talking about a project that I did with a larger research team, mostly in South Africa. And the presentation is titled Practicing Symbolic Citizenship, Qualitative Findings on Motivation for Blood Donation by HIV Positive and Antiretroviral Positive Blood Donors in South Africa. If you give me just a moment, I will try to share my slides. This will go better if you can see those. Here we go. That should work. Before diving into the presentation itself, I would like to just take a moment to acknowledge that I'm recording today on the San Francisco Peninsula in the U.S. state of California. This is the unceded ancestral homeland of the Ramaytush Ohlone peoples. I call on all colonizing governments to work to honor Native people past and present and their connections and claims to place. With that accomplished, I'm going to do what most anthropologists do when they want their audiences to jump immediately into the deep end of something. I'm going to offer you the words of our fellow human beings, in this case, people that we interviewed. I think people living with HIV must be allowed to donate because at the end, blood is blood, whether infected or not. I still believe it can help other people in need. I know that I'm diagnosed, but I never told myself that I cannot help a person. When it comes to the "Are you HIV" part, that's the part I didn't understand. As we are HIV people, are we not allowed to help other people? The ones who are positive will feel discriminated because we also want to help with the blood. It's like you're discriminating us because do you still remember when this thing first started? They said, even if we touch a cup, you will infect someone. If you greet someone, you touch a hand. I still feel it's like that because we are human. These glimpses into some of the deepest of human emotive experiences, solidarity, alienation, surfaced during interviews with people in South Africa whose blood donations had screened positive for HIV and antiretroviral medications, or ARVs. They are not the motivations we usually talk about when we talk about donor motivations. But as Masser, Ferguson, Merz, and Williams argue, if we are to truly understand donors, then engaging with emotions and understanding the context in which they arise is crucial. I want to use this talk to show that attending to context and emotions can open up a fullness of meaning in the donor experience we might otherwise miss. In general, I believe the meanings donors assign to their experiences and the mechanics of that assignation is another underexplored avenue for understanding donor motivation and behavior. Let's backtrack a bit and catch you up on how this study came to be. I'll mention our main findings and then move on to examining the connection between blood donation and what I've called biomedically mediated citizenship, which is a bit of an unfortunate mouthful, I admit. Then we'll get to some implications and conclusions for the findings. Okay, so several years ago, personnel at the South African National Blood Service, or SANBS, became aware of reports of undisclosed HIV positive status and ARV use among their blood donors. And subsequent research confirmed that almost 10% of all HIV positive donors who donated at SANBS screened positive for ARVs. Now, in response to this, we developed a mixed method study to explore the associated donation motivations. The study included a survey and individual in-depth interviews. The social ecological model provided the conceptual framework. So survey items and interview questions addressed levels at the individual, social, cultural, and policy levels. We collected motivations data from 25 of the 122 donors identified in the prevalence study. Today, I'll be drawing exclusively from the interview data, which have been subjected to both thematic and a contextualized discourse analysis. And as much as it pains me, in the interest of brevity, I'm going to give exceedingly short shrift to our main findings. With any luck, that paper will be out soon, and anyone who's interested can check it out or reach out, and I'm happy to talk to you about it. Now, regarding reported donation motivations, the vast majority sorted into just two themes, which we termed altruism and privacy concerns. There were two distinct subthemes in the altruism motivations. The first was general altruism, and this included things like awareness of the general or seasonal need for blood, and examples of what Ferguson in his 2020 typology would term downstream indirect reciprocity, like donating because one's mother had previously received a transfusion. The second subtheme, which is, to our knowledge, novel in the donor motivations literature, was the specific wish to donate so that the blood could be given to a recipient who was also living with HIV. The other primary factor raised by interviewees as playing a meaningful role in their decision to donate was a lack of privacy. Most narratives included encountering an opportunity to donate blood when donors were with other people to whom they had not and did not plan to disclose their HIV status. And keeping a long story short here, both opting out of donation and accurately disclosing one's HIV status during pre-donation screening were perceived as simply too dangerous to countenance. Understanding why required attending to context during data collection and analysis for this project. That is, we anchored these narratives in the social and physical environment, the steps of the donation process, and wider cultural influences, like, most crucially, persistent and powerful HIV-related stigma. In some way, the fundamental motivation here isn't even about blood donation. It's about preserving confidentiality around HIV status. And especially because many of these interviewees reported confidence that SAMBUS would identify their donation as HIV positive and discard it, then participating in the blood drive they'd encountered was framed as the best way out of a threatening situation. Now, informed by this analytic frame, we understand blood donation by those who wish to avoid HIV status disclosure as an attempt at physical, social, and economic self-protection. And through inductive analysis, we started to notice statements that suggested blood donation might be involved in deeper underlying cultural logics of respectability and citizenship as well. Our preliminary conclusion here is that in addition to all the other things it does, for some participants in our sample, blood donation functions symbolically to enact continued biopolitical belonging in the face of their HIV diagnosis. Now, this finding is grounded in the anthropological literature on variously termed forms of health-related citizenship. If it seems odd to you that we're using the word citizenship to talk about this, just know that citizenship is used because it implies membership in a community and involves rights, duties, participation, and identity, all of which become salient at various points in this analysis. So specifically here, I'm referencing a suite of formulations that came out from the early 2000s on, including biological, sanitary, and patient citizenship, among others. This work often draws on the concept of biopower, and I don't have time to, unfortunately, really get into any of this today. But you should know that in general, all of these conceptualizations involve the mobilization of an aspect of one's biological self as a resource to qualify for certain rights, especially healthcare. And further, particularly in Beale's work, being diagnosed with a highly stigmatized condition like HIV puts an individual's worthiness of social inclusion both symbolically and materially in question, and hence often prompts resistance on the part of the diagnosed person. So our analysis draws in some form on all of these antecedents, which is why I've put them on a slide for you. In the end, we concluded that the instances we observed in our data were different enough from all of this work to dissuade us from adopting any of these terms. So we settled on this biomedically mediated citizenship. So let's get to it. Our analysis shows that claims of biologically mediated citizenship were advanced by over half of the interviewees. That's more than the number that reported either of the main thematic motivations. The segments came from 9 women and 4 men, and they cross-cut the other reported motivations. These segments either reference blood as the fundamental human commonality, or they invoke biomedical indicators or discourse related to HIV as the basis for the claim to citizenship. The latter could mean a CD4 count, an undetectable viral load, talk about HIV as a chronic infection that allows one to live a basically normal life, those sorts of things. Now, in contrast to the work I talked about before, the claims being staked here are not up for material benefits or to advance the donor's individual health. They are about rights and constitute an assertion of belonging in the body politic or a contestation of one's presumed exclusion from it. The key take home here is that in these claims, blood donation functions as both a marker of and producer of bodies and selves that merit social inclusion. Now, in the interest of time, I'll limit the examples today to just the quotations we read together at the opening of the talk. All of these focus on blood as a human commonality and a symbol of belonging. I won't read them again, but here they are for you in case you want to refer to them as I talk. We see the first quoted interviewee says plainly, blood is blood. In essence, this substance brooks no distinction, and under that logic, deferral from blood donation can almost be seen as dehumanizing, again, on a symbolic level. These quotations also frame donating blood, which is glossed as helping people in need, as a duty and a privilege associated with belonging or citizenship in the human collective. Donation becomes a kind of symbol for participation in social life itself. Hence, being deferred is tantamount to being thrown out of biopolitical community, and these donors discursively contest that. That last bit, we are human, aside from being a poignant evocation of an earlier era, it also speaks to the symbolic exile that deferral from donation can affect. The need to explicitly claim one's humanity usually indicates that it's been called into question in some way to begin with. So, you might be wondering, what do we do with all of this? Well, practically speaking, primarily based on the understanding of motivations for and context of HIV and ARV positive donation achieved through this research, we are pleased to have developed recommendations that SAMBUS might enact to reduce the likelihood that people living with HIV will donate. These include upstream approaches like raising awareness among people living with HIV of their deferral from blood donation as a way to reduce the potency of altruism as a motivator. They also include more proximate point of service type interventions, like devising procedures to assist those who are aware of their deferral, but still feel unable to opt out of donation. So there's a lot more to say about those interventions, but I'll leave that for another day because most of this talk has focused on the symbolic components of donor experience. And symbolically speaking, the picture is a bit more sobering. The fact is, eliminating HIV and ARV positive donation would benefit blood collection organizations and potentially blood recipients. But for every such donation avoided, a person exists who will have, in essence, been told, whether through community outreach or individual deferral, we don't want your blood. And this, regardless of its current necessity, can indirectly reinforce harmful stereotypes about people living with HIV, that they are dirty and dangerous. Now, not all deferrals are the same, but the emotion and deep symbolism in the assertions of citizenship cited in this paper should alert us to how important it can be to address deferrals with respect and sensitivity, especially when they occur along the lines of already stigmatized identities or health conditions. So we recommend developing operating procedures or guidance that support donor-facing staff in doing this. In addition, offering people who have been deferred another way to participate in the life-saving efforts of blood collection agencies, that is, symbolically including them as worthy citizens, may lessen the sting of deferral, although our research wasn't designed initially to address this, and it would warrant some exploration. Overall, we feel it's imperative that blood donor messaging relating to referral based on HIV not further stigmatize those living with the virus. To achieve this, crafting messages both for public awareness campaigns and for use in individual deferrals should be done in collaboration with people living with HIV. Finally, I'd like to return to a point I made at the outset of this talk and offer this research as an example of what can be gained by attending to context and meaning when seeking to understand donor motivation. Meaning in general, and specifically the way donors derive meaning from their experiences, is underexplored in research on blood donors. There seems to be an assumption that meaning is unitary and self-evident, and that is patently not the case. As an anthropologist, holism is my watchword, and my preference is usually to include some kind of ethnographic fieldwork in research designs because it enables such a deep engagement with context and meaning. While that isn't always feasible, we can design research that's sensitive to these concerns. And in this case, doing so made plain that when our participants said, for example, blood is blood whether infected or not, I still believe it can help other people in need. It was not merely a factual inaccuracy of which a donor living with HIV needed to be disabused. It was also a symbolic defense against stigma. We can and should support that fight. I'd like to thank, first of all, our research participants, also our wonderful interviewers on this study, and just thank NHLBI and NIH, the Fogarty Center, for all of their support of this research. Here's my email, shughes@vitalent.org. Vitalent.org. Please feel free to reach out. I would love to be in contact with all of you. And once again, thanks to the Donor Research Network for the invitation to present today.